Hey, this is Sarah with RegisteredNurseRN.com, and today I want to talk to you about clinicals in nursing school. As a student, I know you're probably really excited about starting clinicals. That's usually the highlight of nursing school because in clinicals you get to learn and you get to see what a real nurse does and what you will be doing after you graduate nursing school. So what exactly are clinicals in nursing school? Clinicals are where you go as a student with a clinical instructor and your classmates to different facilities. You'll be in various facilities such as the ICU, the ER, PEDS, NICU, PICU, home health, health department. So you'll be in a variety of settings. In these settings, you'll learn many different skills. Usually how it's set up is that you will have a lecture class that will correlate with the clinicals you're going to be going to. So for instance, say that semester you're taking maternity health, which is OB. You'll have a lecture class during the week, and also on the other days that you don't have lecture class, you'll have clinicals which will correlate with that maternity class. So that will be really neat. It will help you learn what you're learning in clinicals and in lecture and help
During
you
my time in nursing
school. I was in many different settings and I got to experience so many things and learn so many skills. One thing that really stood out to me was during my maternity rotation. I got to observe a C-section in person, which was absolutely awesome to watch. I got to watch the OB doctor cut the lady's abdomen, and he pulled out the uterus, and I could see the ovaries and the fallopian tubes and the uterus itself, and then he removed the baby, which was an amazing experience to see. And then that very next week I got to watch a vaginal birth, so I got to compare the two, and I got to see a baby be born vaginally. When that happened, it was really neat because I got to see the placenta and the umbilical cord, and the nurse that we were with was really good. She let us, of course we put gloves on, she let us look at the placenta and analyze it and look at the umbilical cord, because during your lecture class you'll learn some things you have to look for with abnormalities with the placenta and umbilical cord. So this really helped me for exams. So that was really neat to watch. You are graded during your clinicals. Normally how you're graded will be how I was graded. This depends on your clinical instructor, but with my experience, I had to do care plans on certain patients during that rotation, and at the end of the day, of our clinical day, we would have huddles where we would have to do quizzes and just share our experience throughout the day, and that's how we were graded. The grading is a little less stringent compared to lecture classes, but you still have to do things where you will get graded on. How are the hours with clinicals? That's a big question I get because people have jobs and they have family. This is very dependent on your nursing school, so you really need to contact them and ask them that. But with my experience with that, like I said, we would have clinicals during the week on the days that we wouldn't have lecture classes, and the max hours we would work is probably anywhere from 12 to 15 during the week at a clinical. I would normally have to get up and be there at 6:30 in the morning, and I would work anywhere from 2 to maybe 6 and do that. So other things that people worry about is if you get paid. Normally you don't get paid for clinicals, so you're there to learn and you don't get paid. So that's a bummer, but that's usually how that works. Benefits and why clinicals are important. Clinicals are very important because it's going to give you an idea as a nursing student what you want to do after school. I knew people who at the beginning of the nursing program said, I want to be a psych nurse, and we went to psych clinicals. I remember them telling me, I don't think I want to do that, and I think they ended up working in the ICU. So it really helps give you an idea of what you want to do, what you're going to like doing, and what you're not going to like doing. So my tips I would give you during nursing school, during your clinicals, is to really get in there, get your feet wet, and don't be scared and don't be shy. A lot of times you're going to probably have nurses come up to you and say, hey, who wants to start an IV? Who wants to put this NG tube? Who wants to come help me do this? Always jump up and always say, hey, I'll help, I'll do it, because that will give you experience and help give you the skills to do that. I know some people get really shy and nervous because you feel like you don't know anything, but everyone feels that way, but just get out there and try because it'll help you in the long run. Another tip is to network. Whenever you're in these settings, you're going to be working around people that potentially may be your coworkers in the future. So network with these people, let them know your name, and form relationships with them. And also, you'll probably be introduced to nurse managers. So be sure you let them know your name and that you may be interested working in their unit, because nurse managers are always looking for nurses. So always network. It's always a good place to get your foot in the door. So that's a little bit about nursing clinicals and nursing school. If you have any other questions, be sure to come to my forum on registerednursern.com and ask any questions. And I have a huge section on clinical nursing skills. It talks about skills you'll learn in nursing school along with some videos. So come there and check that out. And if you like this video, please share it with your friends and subscribe to my YouTube channel. And thank you so much for watching.